Anyhow, let's go ahead and get started with our first question. And then during the webinar tonight, you'll see that I will be doing some computer screen sharing. I'll be showing you some of the resources that we have through our site, the Treat Lyme and Associated Diseases site, and specifically through something called the Treat Lyme book. Many of you are probably aware of that. Many of you have subscribed. If you have not subscribed yet, I hope after you see the webinar tonight that you'll see the benefit of the book and take some time to subscribe for that as well too. All right, so let's go ahead and get started. I'm going to go ahead and take the first question here. And what I do with these questions is I actually really don't even pay attention to them until I post them. And what I do with these is I'm just going to literally cut and paste them on a screen so that you all can see them as well too. And to do that, I have to do a screen share. So let me go ahead and get myself ready to do that here. Okay, so let me go ahead and post up the first question here. Oops, that did not go well. Try that again. I hope I'm not going to have trouble here. Just a minute. I'm going to go back here. Uh-oh. Darn it. I may have a problem here tonight. Hold on, I'm going to try this one more time. See how that goes. There we go. All right, somehow I got that to post. Now let me go over here. No, that's still not showing up quite the way I wanted to here. Bear with me, everyone. I'm sorry. I'm not sure why this is working out so awkward tonight. Let's try this again. There we go. All right, so I'm getting there, everyone. Okay, so this is a question from Isabella. And what Isabella says is, "Hi, Dr. Ross. Thank you for taking my question. I've really been enjoying your webinars and getting amazing information from your Treat Lyme book. I have had interstitial cystitis for the last 15 years and have had fatigue, cognitive issues, noise, and chemical sensitivities the last 5 years. I have tested positive for Lyme and started treating with minocycline 4 weeks ago. My ND added charcoal and cholestyramine to help me get rid of mycotoxins, as I also tested positive for ochratoxin A and trichosethine. Just trying a quarter teaspoon of cholestyramine badly irritated my bladder, and I haven't touched it since. My ND believes I'm also dealing with Bartonella. I've been on a strict interstitial cystitis diet and taking Almiron. Unfortunately, I also had urinary retention from some meds, low-dose naltrexone. My ND was thinking of adding rifampin next to treat Bartonella, but pharmacist said it increases the acidity of the urine and may irritate my bladder if I'm sensitive. I don't know if it is the meds or a reaction to the meds that causes these bladder flare-ups. Do you know what I can take to get rid of Lyme and interstitial cystitis that will not irritate the bladder and ultimately heal my bladder as well? That's a really good question. All right, so let me go back here. Okay, so Isabella and everyone, I apologize for the inconvenience. I don't know why my questions weren't cutting and pasting well enough there from earlier, but hopefully I don't continue to have that problem as we post the other ones here in the future. So Isabella is writing about Bartonella and interstitial cystitis and taking medications for it. So everyone, interstitial cystitis is a bladder condition where the bladder lining gets inflamed. and gives symptoms similar to having a bladder infection. So when that lining gets inflamed, people often will have burning on urination. They may have an urge to pee frequently. They may actually have difficulty starting and or stopping urination. And so it can become quite complicated. Often because of the way the symptoms appear, it looks like a bladder infection. And before we say somebody has interstitial cystitis, we always should make sure at least one time to do a urine culture to make sure there aren't bacteria growing in the urine, meaning having a regular bladder infection. We should rule that out with the urine culture. But if that rules out, then most likely this is interstitial cystitis, inflammation of the lining of the bladder, caused by Bartonella, most commonly, sometimes actually caused by a Lyme infection too, okay? Now, in terms of treating Bartonella, as many of you know, if you've been here before, you know that I recommend using 2 prescription antibiotics at a time. This is one place that I don't think herbal antimicrobials work that well. There are some herbs you can use, but they only work about 50% of the time. Prescription antibiotics, on the other hand, will work about 80–85% of the time to get rid of Bartonella. One of my favorite regimens is to use the drug rifampin that Isabella was talking about doing, coupled with minocycline, actually. In fact, I use those 2 regularly, Isabella, even when somebody has interstitial cystitis. And I actually do not agree with your pharmacist when they said that taking minocycline would make the interstitial cystitis worse. I have not seen that happen. Minocycline is acidic, though, and as a very acidic medicine can sometimes irritate the stomach lining, but I have not seen that happen with somebody that already has an irritable bladder. I don't see it as something that actually irritates the bladder, okay? So I don't agree with your pharmacist. Now, that being said, there are some things you can do to treat the symptoms of your interstitial cystitis, okay? So number 1, when you have interstitial cystitis, you should treat for Bartonella. All right, that's kind of like a hallmark symptom. The other thing is treat for Lyme if it's present too, okay? So dealing with your interstitial cystitis means treat your germs, all right? And I like minocycline and I like rifampin as a possibility for you on that, all right? The other thing that you should look at doing is healing the lining of your bladder. And there's 2 herbs you can take, and you actually mentioned them, although you indicated you're not taking them, okay? So one is the herb called quercetin, and I'm just re-looking at your question here. I believe you didn't say you're taking those, but you would want to take the herb called quercetin, and everyone, that's spelled Quercetin. Quercetin is a chemical that comes from colorful fruits and vegetables. It's called a bioflavonoid. It acts as an anti-inflammatory, and when you take it as 250 milligrams, 2 pills, 3 times a day, it helps decrease inflammation in the lining of the bladder, okay? So that's one thing you want to do. Second thing you want to do is to protect the lining of the bladder, and you want to cover it with a slime layer, basically. And what does a good job with that is to use glucosamine sulfate, okay? Now, glucosamine, many of you may be aware of as something we use to rebuild cartilage when somebody has cartilage injury to a joint or they have arthritis in a joint. And that's one way that you can use glucosamine. But the other thing that it does is in the bladder, it's broken down and creates a microscopic gelatinous coat of the bladder lining, okay, which is what we want here, okay? And so to do that, you want to take it as 500 milligrams 3 times a day, okay? So you can use these as 2 separate supplements, glucosamine sulfate, 500 milligrams 3 times a day, or, and with quercetin, 250 milligrams, 2 pills 3 times a day, okay? So you can buy them individually. Or there is a product made by a company called Vitanica called Bladder Ease, and Bladder Ease has both quercetin and glucosamine sulfate in it, and you would take it at the Bladder Ease as 4 pills 3 times a day, okay? Now, let me show you a couple articles that you can look at here on your own where you can get this information if you happen to have missed it here tonight. So I'm going to do a screen share to show you that. All right, so everyone, this is our site, Treat Lyme and Associated Diseases. Some of you have not been here for a while. will say, oh my God, this looks different. And it does. I've been reworking things. I'm trying to make it a more usable format for the book part of our site, okay? So where I am right now, if you're gonna see, this is our left-hand navigation menu now. This menu will stay here even when you move through the book, okay? And I did that because I was getting complaints that people couldn't figure out how to get around the book. Well, we've left the navigation menu right where it is now, okay? All right, so that won't move, okay? Now, what I want to look for is the chapter on the bladder, okay? So this is our table of contents, the chapters, you can see it over there, all right? And I want to look for the bladder section, all right? So I'm clicking on, this is our bladder chapter, okay? And in the bladder chapter, there is an article called Plumbing Repair, Natural Medicines for the Bladder, all right? And I would take a look at this later. This is where I talk about interstitial cystitis, and I talk about what you can use to heal it, including the bladder ease herbal combination I was just telling you about, and also the quercetin and the glucosamine. And actually that bladder ease, I'm sorry, it's not 4 pills 3 times a day, it's 3 pills 3 times. Actually, no, it is 4 pills 3 times a day. Anyhow, take a look at this. You can see what the recommendations are that we have here. Okay, so that's one thing I want to show you. The other thing I want to search for is the article that we have on how to treat Bartonella. Because as many of you know, I just said that we can treat Bartonella. All right, and so I'm just doing a quick search here. Okay, so for Bartonella, our article is called Kills Bartonella, a Brief Guide, okay? And what you should take a look here later. I'm not going to walk through the whole thing, but what I talk about is when we treat Bartonella, we want to use combinations of antibiotics. And my favorite is this group called rifampin-based treatments, okay? And rifampin-based treatments involve rifampin, and they also can involve minocycline, and I talk about it right here, all right? So if you're looking later for other ways that I treat this, go ahead and look here, okay? All right, now let me go back here. I'm gonna stop the screen share. Okay, so one other point. When we treat a chronic Lyme disease, one of the things, as many of you know that I talk about often, is the way to feel better when you're treating Lyme is to lower inflammation chemicals made by the immune system when you have Lyme called cytokines, okay? Cytokines are made by white blood cells. They're good and they're bad, all right? On the good side, they cause more white blood cells to be made when the immune system sees Lyme germs. They help draw those white blood cells to where the infection is, and they help those white blood cells work better. Now that's all good. However, the immune system does not do good when somebody has Lyme, and it can't get rid of the germs, and it keeps trying harder and harder, and eventually it makes too many cytokines, okay? Now, too many cytokines can be a problem because too many cytokines give you symptoms that we call Lyme disease symptoms. So too many cytokines make it so you can't sleep, they cause confusion, they make you tired, they make you hurt. Anyhow, all the symptoms that we see with Lyme, most of those are caused by excess cytokines. The quercetin that I just mentioned for you is great because in addition to help getting inflammation down inside the lining of the bladder, quercetin also lowers cytokines by getting inside of white blood cells, blocking the production of those cytokines, okay? Now, I just showed you the Treat Lyme book here a little bit ago. There is a whole article we have on quercetin. Actually, I'll just show it to you real quickly here. Let me do another screen share. Okay, so here we are back in the Treat Lyme book. I'm just gonna search for the article that we have on quercetin. All right, so that's our article on quercetin, okay? Y'all can take a look at this later, but just want to let you know we have a whole article written just on this herb because of how important it is in managing this illness, okay? All right, so let me stop sharing here again. Okay, there we are. Isabella, thank you for that question. All right, let's take another question here now. We'll see if I have better chances of getting this thing to actually copy this time. So bear with me here a minute, everyone. I'm trying to make sure that I can get a copy of this question so that I can post it for you, okay? So let me do a screen share here. Okay, so this is Isabella's question, and I'm going to try to replace it now with this one, a question from, I think it's Eric that wrote it. So let's see if I can get this to go. Yes, it did. Good. All right, let me clean this up. I'm glad that one worked. I was getting concerned from earlier. Okay, so okay, this is Eric's question. Let's see. My wife has Bartonella and possibly Lyme still, and has had gallbladder issues the last couple of years. Had an ultrasound done and it detected no stones, sludge, or inflammation. She really has to watch what she eats or she has attacks. Our doctor wants her to remove it and says Lyme Bartonella can live in it. He feels keeping it will hinder ever ridding her body of Lyme and Bart. She's hesitant to remove it and add digestive issues to the problem she already has, but of course we both just want her to get better. She had horrible irritable bowel syndrome many years ago that she cleared up and never wants that again. We also plan on trying to conceive and know that usually causes more gallbladder issues. Thoughts on this? Okay, I just want to look at one other thing about your question here. Let's see. I'm still here, I'm just reading. Okay, so let me go back here. Thank you for that question, Eric. Okay, so it's a tricky question. There's some information I wish I knew about your wife, and unfortunately this forum doesn't allow us to do that. But first of all, women that are at age 40 and overweight tend to have more problems with gallbladder than women that don't, okay? And so if your wife is in that category, there is a greater chance that the gallbladder will not recover adequately as she treats her Lyme and her Bartonella. So I just want to make that as an overall comment. Secondly, I do agree with your physician that Lyme can be associated with gallbladder problems. And in fact, we think that for some people, it's not, or actually let me rephrase that. It's not uncommon when somebody has Lyme infection, not Bartonella, but the Lyme infection, that they might have gallbladder issues, okay? When we think that the Lyme infection lives in the gallbladder. Now, often treating for Lyme will get rid of the gallbladder issues, all right? In other words, getting rid of Lyme will help the gallbladder to do better. I haven't seen Bartonella as a cause of gallbladder issues, and so that's not my experience. I can't say that your physician is wrong in suggesting that, but that hasn't been my experience. So my big thing that I would suggest doing before you think about getting the gallbladder out is you need to consider with your physician as to whether Lyme has been adequately treated in all ways possible, all right? And if you've exhausted the various ways of treating Lyme, then it may be time to get that gallbladder out, but I'm not convinced by it. In terms of treating Lyme, and again, I don't get to ask you questions about all the things that you've tried, let me just point out some key steps that anyone that treats Lyme should make sure that they do, okay? So I'm just gonna show you some things to do that, all right? So what is an adequate Lyme treatment, everyone? Well, let me show you. I'm going to do a screen share to do this. All right, so we're back here at our site, Treat Lyme and Associated Diseases. I'm going to look at our Treat Lyme guidelines, our Lyme disease treatment guidelines, okay? And that's what we're looking at here. Now, our treatment guidelines are called the Successful Treatment Recipe, okay? And what this includes are the steps that anyone should do throughout their Lyme disease treatment, all right? And I call these essential steps to health. And they're designed to boost your immune system, help speed your recovery, kill infections, and protect and repair the consequences of having your infection, all right? So you need to make sure in terms of getting well that you have done or are doing all of these at the same times that you're taking your antibiotics or herbal antimicrobials to poison your Lyme germs, okay? So the first thing you want to do is make sure you get sleep. We tell you ways to do that. Number two, you want to make sure you knock down inflammation cytokines. I already talked tonight about cytokines. They make you feel bad, but also those cytokines suppress the immune system. So you want to make sure you're doing everything you can to lower those. We like working with the herb called curcumin. I also mentioned using quercetin tonight, but lower cytokines because they suppress the immune system too, okay? Third thing you want to do, anyone should do, is be on an herb that helps your body adapt to stress. And for that, we like working with the herb called ashwagandha, all right? Number 4, make sure that you have and are correcting any hormonal abnormalities you have. The most common in Lyme are low adrenals and low thyroid. We tell you how to figure that out here in this section and what to do, okay? So take a look at that. 5th thing you want to do is make sure you are on a good multivitamin that's designed to support the immune system. The ones that we like, there's 2 powders. One is made by a company called Thorne, and then there's another powder made by a company called Integrative Therapeutics. Our preference is the one made by Integrative Therapeutics, which is called the Energy Infusion, okay? Next thing you want to do, make sure you get yeast out if they're present, because yeast will cause more cytokines to be made, and cytokines suppress the immune system. 7th thing you want to do is treat your Lyme germs. We tell you how to do that. 8th thing you want to do is make sure you're taking basic steps to detox. We explain what those are here. Number 9, make sure you're treating your co-infections at the same time you treat your Lyme germ, all right? And do exercise to tolerance. And if you're not getting better by around 6 months and more, then consider adding in these additional steps that we talk about right here, okay? But basically, the first 11 steps of our successful treatment recipe are actually ones that help support your immune system. So make sure you do that, okay? All right, the other thing that you want to do is to make sure that when you treat your Lyme, that you are treating adequately, all right? So I'm going to go to our infection treatment plan section here, and you want to take a look at our article called Kills Lyme Germs, a brief antibiotic guide. And in here, we talk about the key steps that you want to look at in terms of getting rid of your Lyme germs, which is basically you want to be on 2 different antibiotics that treat all 3 forms of the Lyme germ, okay? And so make sure that you have done that as part of your Lyme treatment. And we describe that here. Basically, the Lyme germ lives in you in 3 separate forms. And those 3 separate forms are called spirochete, which looks like a corkscrew. There's something called intracellular Lyme, which is Lyme living inside of your cells. And then there's a 3rd form, which is a microscopic cyst form of the germ. In addition to following all the steps of the successful treatment recipe that are designed to boost your immune system to get over Lyme and to help you feel better, make sure that you have used at least 2 antibiotics or 2 antimicrobial herbs that treat all 3 forms of the germ at the same time. If you don't, if you only use 1 antibiotic that treats 1 or 2 of the germ forms, the 1 form that you're not treating, the others that you're treating will jump ship. They will convert into that other form, and you're just not going to get well because they're really not getting rid of the germs, okay? All right, so those are just some general comments that I have for you. All right. Thanks for that question, Eric. I wish I knew more specifics about your situation, but I hope that gives you some insights, okay? All right, let's see here. Our next question is from Jen. So let me make a copy of her question and I'll get it posted here for everyone. Okay, so that's Eric's question. Let me go ahead and post Jen's up here now. Okay, so this is Jen's question. Let me get it enlarged in a way that we all can read it here. All right, hello, Jen. Let's see. With chronic neurodegeneration getting worse over the last 6 weeks and now having to wait another 5 to 6 weeks for blood, urine, DNA for Lyme and co-infection results to come back, will the nervous system fully recover, or will there be permanent damage to the legs, very wobbly and debilitating, arms and brain? Many thanks, Jen. All right. So let me go. I'm going to stop screen sharing here. Let me go back so that you all I can be seen here. Okay. So Jen, it's a good question. So I guess the big question is, well, there's two things your question raises. One is, can some of the injury caused by Lyme and the co-infection, Bartonella in this case, because if you have a lot of neurodegeneration, I would wonder if the Bartonella co-infection, another infection you could have gotten from the Lyme bite or a tick bite that gave you Lyme, is a bacteria called Bartonella. It can give you bad neurologic conditions as well as can Lyme. And typically when somebody's got bad neurologic Lyme, we often are going to treat for the co-infection Bartonella, even if testing is negative. And the reason we would do that, and in fact, I don't even advocate doing Bartonella testing, we estimate that there are 30 strains of the co-infection called Bartonella, and we are only able to really test well for 2 of those 30 strains. So if somebody's got enough going on that says Bartonella, I'm going to treat for it. And basically anyone with neurodegenerative Lyme, severe Lyme, whether it's Parkinson's Lyme, multiple sclerosis caused by Lyme, Lou Gehrig's disease caused by Lyme, or somebody that's got severe neurologic symptoms as part of their Lyme, I'm going to treat for Bartonella, okay? It's just something that should be done, okay? Now, can Lyme and can Bartonella give you permanent nerve injury? The answer is yes. Does everyone with severe neurologic Lyme have permanent nerve injury? No, okay? When we treat for Lyme, it is possible that a person may recover all of their injured neurologic function. It's also possible that we just aren't going to be able to fix what is there. And improvements literally can range up to 100%, but treating for neurologic Lyme, just like treating for any kind of condition in Lyme, is an average treatment of 2 years if we start treating the condition a year or more after you got the infection, okay? So your odds of recovery are an average of 2 years to get well. Improvements can range up to 100%. They may or may not though, okay? Now, will waiting an additional month make a difference for your outcome? Probably not. All right, it probably doesn't matter if you wait another month or not. And that is because the Lyme germ itself is extremely slow replicating. By some estimates, each germ replicates every 4 weeks to every 8 months, all right? So waiting another month for the Lyme germ isn't gonna really make much of a difference, all right? However, usually what I do in situations where I have somebody that I feel very, very strongly that they have Lyme, even while I'm waiting for test results to come back, I'm going to start treating for Lyme, all right? So I would hope that your doctor might have considered just starting a treatment for you while they're waiting. They should have a discussion with you, though, as to whether it's really a relevant thing to do or not, so that you're involved in that decision, too. But generally, if I've got somebody with bad Lyme, I'm going to go ahead and start treating right away while I'm waiting for things to come back, okay? All right, so Jen, I hope that gives you some things to think about, okay? And good luck for your situation. I'm sorry to hear that's the place that you're in right now. All right. All right, everyone, let's see. I'm going to go ahead and take another question here. All right, so this next one is from Kelly. Let me go ahead and get it posted up here. I wish I had a less awkward way of doing this, but I don't. Our old webinar service provider actually would just post everything right up for us, nice and clean. Well, this is very interesting. Bear with me here. All right, so our last provider had a way that I could just literally post the question right from where it was asked, but this current program doesn't allow us to. But I like this current way of doing the webinars because we get a much cleaner video quality and my voice comes through a lot better. So there's trade-offs, unfortunately. But anyhow, all right, Kelly, let's see. Are Lyme headaches common? Do you find Botox or low-frequency laser helpful for pain? When does one consider stopping methyl B12 shots? Are the drops just as good? And any thoughts on the recent article about Clarinex as a Lyme treatment? Kindness, thanks for helping so many people, Kelly. All right, so you've got a lot of questions there, Kelly, and I'll try to answer all of them. Let me go back here. All right, so let me talk about, I'm just going to look over here to the side here. Okay, so let's talk about your headache question first. All right, so are headaches common in Lyme? Yes, they are. And there's different qualities to headaches, okay? So there's people that get headaches here in the back of the head. That tends to be more muscular, sometimes associated with cracking and popping in the neck. That is a classic Lyme headache. The headaches back here are almost uniformly caused by a Lyme infection, okay? All right. Then some people get headaches up here in the front of the head. And headaches in the front of the head can be Lyme, but often when you have somebody that has a headache that is more exclusively in the front of the head, or a person that has migraines, we have to think about the co-infection Babesia. All right. So Babesia, in addition to having symptoms of headaches, also has other symptoms. And so the other symptoms that would make you think about Babesia headaches are, it's common for people with Babesia to have drenching night sweats, for instance. They might have panic attacks, which are bad anxiety attacks. They might have air hunger or feel like you just cannot get enough air at times. Racing or skipping of the heart. A frequent deja vu experience is another symptom that people with Babesia will have, okay? So people with Babesia would have some of these other symptoms. And if you do have some of these other symptoms I just mentioned that are Babesia symptoms, maybe your headache is actually a Babesia headache and you should be treated for Babesia as well, okay? And everyone, here in a minute, I will show you the article where you can look at what Babesia symptoms are. We've got an article that I've written about that I'll be glad to show you so you can help figure out whether you might have Babesia as well too, okay? All right, now, people that have a whole head pressure kind of symptomatology, that can be a Bartonella headache. If you have burning head, like a burning brain kind of, that can be Lyme and Bartonella, sometimes Babesia too. And just general achiness around the head, sometimes that can be Lyme. Pressure headache, I usually find to be a whole head pressure, I find to be more Bartonella. There's a lot of crossover here, okay? Now, in terms of what can you do for your headache situation, well, treat your infections, okay? That's a big thing. Figure out what infection is under it, treat them. Second thing you want to do for headaches is make sure you're taking plenty of magnesium. So magnesium, and the form of magnesium I like for headaches is something called magnesium malic acid or magnesium malate. I like using it as a 150 milligram pill, and I like to have a person take 1 or 2 in the morning and 3 to 4 pills at night. The limiting thing about magnesium is magnesium can give you diarrhea if you get too much. If you do try what I just recommended and you get too much diarrhea, back down on the amount of magnesium that you're taking, okay? Magnesium helps with both migraine headaches. Magnesium also relaxes muscles, okay? The other thing that can be helpful when you have headaches in Lyme is to make sure headaches for any reason actually, is limit your caffeine intake. You may even want to stop caffeine because sometimes caffeine can make headaches worse too, okay? So for headaches, treat your infections, figure out what they are, get on magnesium, decrease caffeine. If that's not working, Botox can do wonderful, okay? So I have no problem with people taking Botox, all right? In terms of laser, I don't know. I've never tried laser for headaches, so I can't answer that one. You've got a question about methylated vitamin B12. You can do that as shots, but actually you can do it as drops. Drops under the tongue. If you could get a compounding pharmacist to formulate a methylated form of vitamin B12, you can have them mix it so there's 1,000 micrograms per drop or 3,000 micrograms per drop. If you do that under your tongue, the B12 gets absorbed through the blood vessels, right there, those blood vessels, under the tongue. It gets absorbed into those and gets right into your bloodstream. It can be as effective as doing shots. You don't necessarily need to do shots, okay? And if you can get your compounding pharmacist to mix it up as 3,000 micrograms per drop, you have a real powerful mixture. Just do 1 drop a day, and that will be plenty for you, okay? Let me see, is there anything else I can do here? In terms of the recent Claritin research, I haven't really been trying it. I do need to look at doing it with some of my patients. But the one thing I would caution you about is it is a laboratory experiment. It was not done on humans, and we really don't know what happens in the lab, does it equate to any meaningful changes that we see in our patients? I have no problem with my patients giving that a try, and I just don't have enough working experience yet to know if that research, that lab experiment is relevant to really what happens with my Lyme patients or not, okay? Whew, I think I answered all your questions there, Kelly. Let me do a quick screen share here. I'll show something from the Treat Lyme book. All right, what was it? Oh, Babesia, how to diagnose Babesia. Okay, so I'm gonna look at our chapter here on diagnosis. I think it's called How to Diagnose. There it is. There's a chapter we have on called How to Diagnose. All right, and let's see here. How to diagnose Babesia. There it is. Okay, so take a look at this article later. I talk about, there's even a video we've done on this one before, okay? And I say, don't trust the test because we estimate there's 15 to 20 strains and we can only really detect 2 with testing. So I usually make my decisions to treat based on what the symptoms are, okay? And I talk about that here in the article. All right, and so those big symptoms I talked to you about earlier tonight, they're all listed out here. All right, so if you want to come back and read this more, see the video I created on this earlier, sometime in the past, come back and look at this article later and it'll give you some useful information. All right, so let me go back here. All right, Kelly, thank you for that question. All right, next question is from Kate. Let me get this copied and posted up for everyone here. Okay, so I'm going to do a screen share again so we can all see Kate's question. All right, bear with me here. All right, that's Kate's question. Let's see. I'm being treated for Lyme and Babesia decani. I had a positive Babesia fish test and B. decani IgM of 80. I have been taking Malarone 100 milligrams 2 times a day for 6 months. I don't have any of the typical symptoms. How much longer do you think I would need to be on the Malarone? Okay, Kate, let me go back here. Okay, so Kate, as I just pointed out to everyone, I usually do not test for Babesia unless I've got somebody that has the symptoms of it. So anyhow, but you did, and so that's fine. In terms of how long do you treat? Well, for most strains of Babesia, we're going to treat for about 5 months, all right? But Babesia decani, when you have it, it's a bit harder to treat, and we usually recommend that people be treated for at least 10 months. And that's because it tends to be more resistant to treatment, all right? Now, your Malarone, you're actually taking a low dose. And so Malarone, everyone, actually has 2 chemicals in it. The main agent is called atovaquone, which is also the chemical that's found in Mepron. Okay, many of you have heard of Mepron before. And in addition, in Malarone, there is also something called proquinil. All right, and the atovaquone should be 250 milligrams, and the proquinil is 100 milligrams in 1 Malarone. Now, I think what you probably were talking about, you said 100 milligrams, is that actually you were referring to the 100 milligrams of the proquinil, which is a quinine-like medicine, and not the amount of atovaquone you're getting. And generally, I'd like to use that at 1 pill twice a day. Okay, so 1 pill of Malarone is 250 milligrams of atovaquone and 100 milligrams of the proquinil. There is a pediatric strength that is lower, and that's why I'm trying to say make sure you're taking the adult strength that I just said, 1 pill 2 times a day. All right? All right. Thanks for that question, Kate. All right, let's see here. Got another question from Darkay. I hope I'm saying your name correctly here. Let me go ahead and see if I can get this posted up. All right, there we are. All right, so let me get this next question posted. All right. I hope I'm saying your name correctly. I'm now being treated primarily for Babesia. I've been ill for 2.5 years, treating since last August with natural remedies only. My ND would like me to take 2 antibiotics for 6 to 8 weeks, which are Bactrim and albendazole. I am reluctant to do so. I have taken artemisinin but unable to take it because of allergic reaction. Now taking ATP fuel, Tussilago for mold, and Sida and zinc. What would your recommendation be if I want to consider to continue with natural treatment, or would you recommend the antibiotics? Thank you. Let me look back through here again. So the Bactrim would be something that can help with Babesia, but also can be a component of a Bartonella treatment. I don't find it to be helpful for somebody that we're using to treat Lyme, for instance, okay? Albendazole is an anti-parasitic that doesn't have any action that I'm aware of against the Babesia parasite, and it is not something I would use for a Lyme infection, all right? Artemisinin can be useful for treating Babesia, but not everyone can use it, as in your situation. And the Sida acuta that you mentioned down here, the Sida that you wrote about, can be something used to treat Babesia and Bartonella and the Lyme infection, but I don't find it to be a very strong agent for taking care of Babesia. All right, so now let me go back here. I'm gonna put my camera back on. All right, so I'm just gonna focus my response to what can you do naturally for Babesia, all right? Because I think that's what you're referring to in your question. All right, so the natural treatment approach for Babesia, there's 2 herbs that I like to use. One is artemisinin, for which you've had allergic reactions, but to be thorough here, I just want to say how I would use it. So artemisinin, everyone, is a Chinese herb, also known as wormwood, and it is a #1 recommended herb by the World Health Organization to treat malaria, for instance, okay? So it rates up there, right up there with prescription antimalarials we use. Now, many of you know when we treat Babesia, we use anti-malaria medicines, okay? And so that's what seems to work best for us, okay? So, because Babesia is a parasite like malaria, right? When we use artemisinin, the most effective way to use it is to use it at really high doses for 3 days and then take 11 days off. And the reason we do that is after you've been artemisinin for 3 days, your intestines develop an enzyme that can deactivate the artemisinin, all right? So the way I like to use artemisinin in an adult is it comes as a 100 milligram pill. I like to have people start at 3 pills 3 times a day for 3 days in a row and then take 11 days off. Now, the days you use it, you may get more Babesia symptoms, and that can even go through the 5th day from when you first start taking it, okay? So it can look like more air hunger, especially more sweats. Those are the things I see, okay? But if you tolerate that first round well, the second time you're gonna do it as 4 pills 3 times a day for 3 days in a row, then 3 days off. Then 11 days off, excuse me. And if that goes well, then the next time you take it, you're gonna do it as 5 pills 3 times a day for 3 days on and 11 days off. And then you just keep doing that cycle, okay? That works about 75% of the time, all right? The other herb I like to use is an herb called Cryptolepis. And Cryptolepis is an herb that comes from Ghana, all right? And the Cryptolepis is used in Ghana to treat malaria. And when you look at the science from Ghana about this, it works really well at treating malaria. When it comes to treating Babesia, I know that one of my colleagues, Dr. Richard Horowitz, writes in his book that he finds it to be really helpful for Babesia, that he's not seeing artemisinin to work anymore, that he uses primarily Cryptolepis. That has not been my experience, and I'm not quite sure how he's using artemisinin, if he's been using it the way I use it at these really high doses. And so I urge people not to necessarily not do artemisinin based upon Dr. Horowitz's recommendations. But the other comment I would make is Dr. Horowitz practices on the East Coast, and I practice out here in Seattle, Washington. Now, I see people from all over the world. Yeah, I do see people from all over the world. But I also see my practice tends to be more based in the Northwest part of the United States. and also Northwest, or the North, or not Northwest, but Western Canada too. I have a lot of people that come from Western Canada to see me as well too. And in my experience says artemisinin works good in my practice. Now maybe the type of Babesia I'm treating here, the strains of it are different than what Dr. Horowitz is seeing in his practice, okay? But again, I wouldn't discount artemisinin automatically based on his recommendations. I have a different experience using it. Cryptolepis I find to be useful about 75 to 80% of the time too. I still tend to work more with artemisinin because I have more experience working with it. But crypto can work well. Now, you've got to watch the source though. I know that there is recently a company, and that we've been trying it too, that has come out with a crypto product that they call Crypto Plus, that is mixed with a bunch of other herbs. I am just not finding it to be as useful as crypto when you get crypto from a source that just uses it as its only herb. And to be thorough about that, the product I like is made by a company called Woodland Essence. I find it to be a little bit stronger than this other product called Crypto Plus. And I even write about the Crypto Plus, but recently I'm just seeing too many treatment failures with it. I find better effect from using Crypto Lepis that comes from a company called Woodland Essence, okay? And I generally, the company that makes the Crypto Plus does great with all of its products. I just am not being as impressed with the Crypto Plus in terms of how it works compared to Crypto Lepis itself as a pure product by this company called Woodland Essence, okay? So if you're gonna use the Crypto Lepis, I like people to take it as 5 milliliters 3 times a day. And it can be pretty potent too, okay? And it may knock you down. You use it continuously. You don't start and stop the way that you do the artemisinin, okay? So the other natural way then is to take Crypto Lepis as a tincture, 5 milliliters 3 times a day. All right, that's what I got for you. So thank you for that question. And good luck to you. All right, let's see here. Next question is from Tina. Let me go ahead and do a quick copy of that. And then we'll do a screen share here. Okay, let's see. All right. Hello, Tina. Okay, let's see. An MD in Saskatchewan prescribed my 7-year-old grandson a 250 milligram amoxicillin today for redness, inflammation, and a large lymph node on his neck. The bloated tick was removed from the back of his neck yesterday. Is that what you recommend for his age, or is doxycycline a better choice? The doctor also did blood work to test for Lyme, so the antibiotic is precautionary. Yikes. The yikes is I don't like what your doc has done here. I'm glad your doc thought to put your grandson on amoxicillin. However, and your doc probably is not aware that, yes, even in Saskatchewan, you can have Lyme. Okay, now, you know, your chances of having Lyme in Saskatchewan is not as great as New Jersey, USA, and New Jersey, 100% of ticks, or nearly 100% of ticks carry Lyme, and about 70% carry one co-infection, okay? I don't know about the tick studies from Saskatchewan, but it is not found as predominantly as it is on our East Coast here, for instance. But I treat a number of people that come to see me from Saskatchewan, and yes, they do get their Lyme there, okay? So if there was a known tick attached and you've got swollen lymph nodes, that says that tick gave some kind of an infection. And there is possibility of 2 things. One is Bartonella, and the other one would be Lyme, okay, would be the most common ones. But there's also the reason I say Bartonella is known to give swollen lymph nodes. Lyme is too, all right? But the other thing you need to think about is that tick, in addition to possibly giving those 2 germs, could have given a couple other infections that we see in Lyme called Anaplasma and Ehrlichia, okay? Now, The treatment of choice when anyone gets a tick that has a high likelihood of having transmitted one of these germs, a tick-borne illness, and the fact your son or grandson has a tick-borne illness because he had a bite and swollen lymph nodes, that says he got germs, okay? And that can even include Rocky Mountain spotted fever, for instance, is another germ that you can get through a tick bite. And the only reason I'm reacting so strongly is your grandson has swollen lymph nodes. That says a bacteria got transmitted, okay? So the treatment of choice, even at age 7, is to do doxycycline, all right? Now, there is a lot of misinformation out there. Most doctors will not prescribe doxycycline because we have been told that it stains teeth of children that have developing teeth, all right? The Centers for Disease Control here in the United States, however, has come back and looked at that information and now reports that that is not so. That actually doxy is a preferred drug to use and that there are minimal risks of getting teeth staining, and therefore they recommend highly doxycycline be given, okay? And they even recommend it be given while you're waiting for the test results to come back, all right? Now, you can help your doctor understand this by going to the U.S. Centers for Disease Control website, okay, and typing in Rocky Mountain spotted fever and try to search for the treatment recommendations for children. And what you will see is they recommend on their website doxycycline, all right? Print that out. Bring it to your doctor, because if they see that somebody like the CDC recommends doxycycline for a child of your age, they're probably going to prescribe doxycycline, all right? And so I would do that, and I hope that your grandson gets some help, okay? So go to the United States Centers for Disease Control and Prevention website. I looked at this maybe about 6 or 9 months ago. There is an article on there about how that doxycycline should be used because it will take care of your Bartonella, it will take care of your anaplasma, your Ehrlichia, the other infections, and is the treatment of choice to prevent Rocky Mountain spotted fever, and also is a treatment of choice for Lyme, okay? And but you need to probably going to coax your pediatrician along, your kid's pediatrician or your grandson's pediatrician along, because they have been taught, like I was, that we don't use doxycycline in kids under 8, but that information is out of date, okay? All right. Good luck. I hope your grandson does okay. All right. All right, let's see here. You guys are having good questions tonight. Let me go ahead and post another one up here. All right, what do we got here? All right, next question is from Marianne. Besides antibiotics and antimicrobial herbs like cemento and banderol, what else kills Lyme bugs? If they aren't being killed, won't they multiply and I just get sicker? All right. Well, it's a good question. Let me go back here. Okay, Marianne. So in terms of alternative things that you can do that kill germs, I'm just going to list a few of them off. One is there is a electromagnetic frequency machine called a Rife machine. Okay, now I cannot fully recommend it, and I'm not recommending it here. So to any of the authorities from the Food and Drug Administration here in the United States that may be listening into this, I am not advising that Marianne uses Rife machines, but I'm just going to explain to her what the theory is behind a Rife machine, okay? So everyone, the reason the FDA here in the States doesn't allow me to prescribe Rife machines is there are not human safety studies that have been done, all right? But the ideas behind a Rife machine is that it uses electromagnetic frequency waves or sound waves that vibrate with the covering of the germ to cause it to burst, okay? Much like if you were to take a singer and put them in front of a glass of water, that singer could sing with a frequency that resonates with that glass and they can burst the glass. That in theory is what a Rife machine that uses electromagnetic frequencies will do, okay? Now, what do I see? Well, again, I never prescribe them, but my patients that come in using them, from what I can see, it appears that these work about 60% of the time, okay? Now, there's only two things I would say about it. In terms of safety, I know the FDA has its opinion, but, you know, we live in a world of electromagnetic frequencies. I mean, I'm sitting in an office right now that has fluorescent lights above me that are bouncing electromagnetic frequencies. I'm sitting in front of a computer that's bouncing electromagnetic frequencies. I talk often on one of these things that bounces electromagnetic frequencies. And so we live in a world surrounded by electromagnetic frequencies, and they do not appear to cause damage to most of us. Therefore, probably Rife machines are safe, okay? Again, I think they work about 60% of the time. However, they're only going to treat the spirochete form of the germ. They probably are not going to be effective to get intracellular Lyme and the microscopic cyst form of the germ because they don't have coverings that the Rife machine can resonate with, all right? So you're still going to ultimately have to do something about that, all right? Other treatments you could do, you could work with oxidizing agents, which are hydrogen peroxide, ozone, high doses of vitamin C, like 30 grams to 50 grams of vitamin C. Those all create oxidizing agents that damage membranes, and they can kill germs. The problem is they may damage our membranes too, and we don't know long-term what the effect of using oxidizing agents will be on a person, okay? Other things you can consider doing are hyperthermia, meaning heating up to really high temperatures, like about 103, 104 degrees, and staying there for maybe about 20 to 30 minutes, okay? Now to do that, you're going to need to be monitored, but heat can kill germs. That's the idea behind whenever we get sick with the flu, we get high temperatures. Our body is working to kill it, okay? So those are just some additional things you might want to think about in terms of killing the germs. Okay, now there's another part to your question though, and that is if Lyme is present, if a Lyme infection is present, do we always need to do something about it? The answer is no. All right, now that may sound really horrible that I just said that, but let me talk about that. So if somebody's got an infection in them and they're relatively healthy, they do not appear to have gotten Lyme disease from their infection, I don't think we need to treat the infection, all right? Let me round that out a little further. So when somebody has a Lyme infection or Lyme disease, meaning that they're sick from having a Lyme infection in them, when we use antibiotics and they've had Lyme for over a year, the best we're doing is knocking the germ under control, okay? I don't think, and even many of my colleagues don't think, that if you've had Lyme in you for more than a year, even when we use antibiotics, I don't think for the majority of people that we wipe the germ out, all right? The best we're doing with antibiotics is to restore health, okay? So why would I use antibiotics for somebody that their immune system is already keeping their infection under control if they are a person that has a Lyme infection but they're healthy? I wouldn't be using I know I can't get rid of the germ, so it makes no sense that I would use an antibiotic to kill germs and still wind up where we are, which is they have infections that are under control, okay? There's another problem in treating people that have Lyme infection that don't have symptoms of Lyme or have minimal symptoms. And that is, when we use antibiotics, we may cause a germ to get more virulent or stronger. All right. It's possible if we've got somebody that has an infection living in them that is still basically healthy, that their immune system is keeping it under control. If we give them antibiotics, we may actually trigger a germ that is more active, causing them to now develop Lyme disease from their dormant Lyme infection. All right. So with that in mind, I don't advocate treating for Lyme infection every time that somebody has it. All right. And the distinction I'm making here is not everyone with Lyme infection gets Lyme disease, okay? There are many of us that can cohabitate with our germs because our immune systems work well enough to do that. And there are some of us where our immune systems may even get rid of the infection, all right? So I think we use antibiotics prudently, and we mainly should use those at times when our immune system is not keeping it under control, because then the risk of using antibiotics that could trigger a more active germ are outweighed by the risk of the germ already causing bad problems in a person, okay? All right, so those are just some thoughts, Marianne, that I have around antibiotics and alternative ways to get rid of the infections as well, too. Thank you for that question. All right, next question is from Debbie. Let's see here. Go ahead and get that one posted, everyone. Huh. I am not sure how that one just popped up the way it did there. Let me cut that again. Huh. There we are. All right. Well, that is strange. I'm not sure why I'm showing up sideways here, but we'll take it as a sideways question. All right, let's see. From a lumbar puncture, I found out that I have 10 oligoclonal bands of adulting pattern. Do you have any info on this or a connection with Lyme? I also have a positive IGeneX Lyme test and a positive Canadian anaplasmosis. Okay. Let's go. What's going on here? I'm sorry. I'm trying to clean up what my computer is doing here. Having fun playing with my computer here, it looks like. All right, hopefully that's going to work better for the next question. We'll see. Okay, so let me stop that. Okay, Debbie, I'm not sure what this means without any more information, to be quite honest with you. I mean, it could be a pattern that we see in multiple sclerosis, but I'm just not sure. I guess I don't have a comment on that one. I apologize. Every now and then I do get stumped. There's a lot more information I would need to even answer that further for you. All right? Okay. Thank you. Thank you for that question, though. All right. Let's do this. Okay. The next one is from Rob. Okay, this is from Rob. Let's get this posted up. All right, Rob, let's see. You're welcome. What is your opinion on the place of far or near infrared sauna in a Lyme treatment? Okay, good question. Go back here. All right, so Rob, I like using infrared, near infrared, far infrared sauna as a way of detoxing, actually, okay? Those are the main reasons I like to use it. But also it can help provide a way for the antibiotics to get more deeply into the tissue. So it can also augment an antimicrobial treatment, all right? So let's talk about what the saunas do. So infrared, whether it's far or near infrared saunas, what happens is we use light rays that give deep heating, kind of like when you stand in front of the window when it's a hot sunny day. You know how you get hot all the way through? It just feels like everything gets deeply heated, okay? So in infrared sauna, the way it works is it actually uses light waves that penetrate deeply. And in fact, you get equal heating down to about 3 centimeters, okay? So the heat on the level of your skin is equal to 3 centimeters down. In other words, if we were to heat your hand up, everything would be equally hot, okay? And your muscle right here, for instance, about 3 centimeters in, it would be equally hot as it is on the surface, all right? Now that's a little bit different than regular saunas. Regular saunas will heat us, but we heat from the surface. And so you get a temperature gradient where it's hotter on the surface of the skin, and the further you get away from the surface of the skin, that heat dissipates. It goes down. It becomes less, all right? So now that kind of heating causes blood vessels to dilate, all right? Because our body, when it heats up, wants to get rid of heat. And the way it does so is by dilating blood vessels to send more blood flow to the heat so that we can, that heat will evaporate basically, all right? So what that means is small blood vessels in us that normally might not let much blood in, dilate open and let a lot of blood in, and therefore we get better blood flow carrying antibiotics, herbal antimicrobials deep into our tissues. So we get a better kill, all right? So one thing I have to caution people about is when you do start doing infrared saunas or near infrared saunas, make sure that you don't start right away at 30 minutes 3 or 4 times a week. You probably ought to start at 10 to 15 minutes 3 times a week, okay? Because you're going to get a Herxheimer not from the infrared directly killing germs, but rather from getting better blood flow carrying your antibiotics, your herbal antibiotics or prescription antibiotics deeper into the tissues. Okay, so that's one benefit of doing infrared. All right, the other thing that happens is when you do infrared, you heat up. And what happens when you heat is that pulls toxins out of your tissues. And they're all going to go into the blood. Now, some of those get moved into your sweat from the blood. In fact, when we heat up like this, we sweat. 20% of the toxins that get moved by the heat get sweated out. Only 20% actually, okay? The other 80% go to the liver, and the liver then processes them out, moves them out into the intestines, and they get pooped out, okay? So when you detox doing infrared sauna, you have to remember it's not all about sweating. All right. And in fact, if you're a person that doesn't sweat, you're still going to be removing toxins through your liver. So when you do an infrared detox, make sure you're also supporting your liver by being on glutathione. Okay. Glutathione is the master detox chemical found in the liver. I usually recommend that people take it, especially if they're going to be doing infrared saunas, that they take it in an oral form. As a 500 milligram, and you can do it as a product called or you want to do it as liposomal, which means it's microscopically wrapped in fat. Liposomal glutathione, okay, 500 milligrams 1 time a day. And in addition, you want to have frequent bowel movements, at least 1 or 2 times a day, because bowel movements are what are going to carry the toxins out after they get moved out by your liver, okay? And so if you're constipated, you need to get unconstipated. And a good way to do that is to make sure you're drinking plenty of water, okay? So you want to be drinking, take your body weight, divide it in 2 in pounds. So if you weigh 150 pounds, divide it in 2 is 75 pounds. You want to have that many ounces of water. So a 150-pound person divided by 2 is 75. They want to have 75 ounces of water a day, okay? So if you're going to detox with your infrared sauna, make sure you take glutathione to support your liver. Also make sure that you're having regular bowel movements. To do that, make sure you're having plenty of water, okay? That's going to help you do that. The other thing is to have frequent bowel movements and to bind those toxins up after they get passed out by the liver. You want to make sure you're having plenty of fiber in your diet. To do that, I generally recommend that a person has at least 2 to 3 servings a day of whole grains, beans, or legumes. A serving size would be half of a clenched fist. A full clenched fist would be 2 serving sizes. Having about the equivalent of my fist, that much oatmeal in the morning is 2 serving sizes of fiber, okay? Anyhow, just to give you some rough ideas about that, okay? So anyhow, those are some thoughts on the infrared. You're going to get better killing, not because the infrared's killing anything, but because your antimicrobials get further into tissues. You're going to get better detox, but 80% of that detoxing is through the liver. It's not coming out through your sweat, okay? All right, now I want to just show you something here real quick. I'm going to do a screen share. Okay, so back here in the Treat Lyme book, I think I'll have an article on this in Detox. Let's look at here. Okay, so basically, everyone, you will find that about everything that I have written that you might have questions about, we have an article about, okay? So the one I want to look at is the one on infrared sauna. Where are we here? There it is. We have written an article on infrared sauna detox, okay? And here it is, all right? So there's everything I just said is written down here for you. Talk about that you need to have water, you need to have fiber to get the intestines moving. Talk about glutathione and what you can do to help build that up too, all right? So take a look at this article, okay? The other thing is there is an article specifically on glutathione that we have, and I love glutathione. I think it is one of the most important supplements you can do when you're managing Lyme disease because it helps detox, helps repair nerve injury, just helps with all kinds of good stuff here, okay? And so take a look at this. It's called Glutathione, the Great Fixer. We talk about how to use glutathione, what it does, and how you would wind up taking it, okay? All right, so there you go on that. Let me go ahead and go back here. Okay, there we are. Rob, thank you for your question. Okay, I'm not going to post this question because it's a short one. Esther writes, what is the most accurate test for Lyme? All right, so, oh, Esther, that's complicated. I'm going to show you, let me show you an article, and then I'm going to come back and say a few words, okay? So it's a very complicated topic, and you're going to do best by actually reading an article that I've written about this, okay? So again, as I've said, any question you have about Lyme is probably answered in the Treat Lyme book. And if you don't have a subscription for it already, get a subscription for it, okay? It's a really good deal. This is information you can even bring to your doctors if you need to help give them some additional ideas on what to do for you, okay? So in terms of testing, there's a chapter we have called Test, okay? All right, and there's a bunch of articles that we have in here, but in here, I did my own review of Lyme testing, okay? So it's called a review of Lyme infection tests, pass or fail, all right? And if you read through here, you're gonna see there's a variety of ways of doing testing. And I talk about all these terms that we need to consider about doing testing. But then down here, I give my report card, all right? And of all the tests that you can do for Lyme, my favorite, but it only gets a B, is the Western blot, done through a lab that knows what they're doing, okay? And I give it a B grade. That's the best test we have, is a B grade, everyone. All right, now, having said that, so come back, look at this article later. You're gonna see why I describe all the tests you can do, but of those, I boil it down to the Western blot being the best, with a B grade, okay? All right, now let me go back here. Okay, so let's talk about the Western blot. So Western blot, everyone, is a method we can use to see if your immune system has made antibodies that attach to proteins found on the covering of the germ. And antibodies are also proteins too. Our immune system makes these proteins called antibodies. They attach to a germ. Once they're attached to the germ, they act like a big radio antenna, sending signals to the rest of the immune system to say, come, get this germ, here's a germ, okay? And when they attach to a germ, they attach to proteins found on the covering of the germ. Now, you want to use a lab that looks to see if you have antibodies against at least 12 proteins, okay? And there's only 2 labs that do that well. One is the Lyme lab at Stony Brook, and the other one is a lab called IGenix in Northern California. Do not let your doctors have you do a Western blot through a PAC lab or PAML or Quest or LabCorp. They use test kits that are approved by the FDA, and they do not look to see if you have antibodies against enough of the proteins, okay? All right, now, so that's what I would recommend doing. Take a look at that article I just showed you. One other thing, because I'm trying to be brief here, we're getting a little bit long here tonight already, and I haven't gotten through enough questions. There's a lot of questions still sitting out there, but I'm going to show you one other article if you want to know more about doing the Western blot. There is a whole article that we have about the Western blot, okay? So I'm going to go back here look at the back here in the test chapter, okay? And there is a whole detailed video we've done about the Western blot Lyme test. All right, take a look here, play the video. I do a very comprehensive discussion of what the Western blot is and how you use it and what's the best way to do it and what lab does it the best. It's in this article right here, okay? All right, let me go back. Okay, let's see. Thank you for that question. All right, now, where are we here? So Esther, I just got rid of that. And Sylvia, I already answered earlier tonight a question about cryptolepis. In terms of cryptolepis, you ask, is it a good substitute for Malarone? Malarone works about 90% of the time, okay? Or I'm sorry, 80 to 85% of the time. Cryptolepis works about 75 to 80% of the time. So it's a fairly good substitute, okay? If you want to read more about the various treatments that I recommend for treating Babesia, because I have reviewed all of these as well too. Again, any question you have, we have answered for you in the Treat Lyme book, okay? And it's practical and usable. I think many of you know that by now. Let's look at this one called treatment plans, all right? Articles in the infection treatment plans. There is an article we have called Kills Babesia, a brief guide, okay? Take a look at this article. I talk about the various ways that you can treat Babesia, and I break them into 3 tiers, okay? Tier 1 are the most effective ones, and these work about 85-ish% of the time. That's your tier 1 treatments. In tier 2 is artemisinin. These work 75 to 80% of the time. Also in tier 2 is cryptolepis, okay? So I review the various ways of treating Babesia here. I give you the relative chances of success, and I tell you how to go about using them as well too, all right? Okay, let me go back here. Okay, let's see. Jenny says, my LMD is testing me for glutamate for GABA enzyme to see if it is why I had so wired and tired. My brain goes nuts at 4 a.m. and stay agitated until 8 p.m. Does this make sense? So Jenny, what your doctor is trying to do by measuring glutamate levels is he's trying to see if you have an imbalance in nerve transmitters in the brain, all right? And there is a theory that glutamate can be a cause of this. I'm not a big believer in that theory. When I've got somebody that is really wired, either they're jittery or shaky or always agitated, I'm going to treat for Lyme and probably for Bartonella. But the other thing I like to do is to work with a nutrient mineral called lithium, okay? Lithium, many of you may be aware of, lithium is being something that we use for people that have a psychiatric problem called bipolar illness, or also known as manic depression. That's not how I'm recommending it here. We use it for that condition, bipolar or manic depression. We have people take it as 600 to 900 milligrams a day. But when you're using it as a nutrient to calm an agitated nervous system, we have people take it as 5 milligrams 3 times a day. The other thing that has been shown to do is actually improve your thinking. It improves cognition, okay? So let me tell you where you can read more about that. I'm going to do a quick screen share here again. All right, so there is an article on lithium. All right, so it's called lithium orotate, all right? Take a look here at this article later, but I talk about how it improves thinking, protects the brain from toxins, elevates mood, decreases anxiety and nervous system irritability. This is a very good mineral, and I use it frequently with my patients, okay? So I'd take a look at that. All right, let me go back here. Jenny, thank you for that question. All right, I have a question here from Lori. Lori is asking me about Cavanase being helpful for sleep issues and Lyme. So Lori, Cavanase is an herbal complex, and I actually, off the top of my head, I'm not familiar with what specifically is in it, but I do know that people can have some benefits from it, and that's all I can say. It's not one that I usually go to. I have other ones that I use, but I do know some of my patients do get benefit from it. Cavanase, everyone, is spelled K-A-V-I-N-A-N-C-E, okay? It's not one I commonly work with. It's a compound that has various herbs in it. But Lori, yeah, give it a try, see if it makes some difference for you, okay? All right, thank you for that question. All right, everyone, I'm just trying to move quickly here, and I'm not posting every one of these questions right now. Mary asked, is head ear pressure, feeling off balance, and subsequent fatigue a common symptom? All other symptoms are pretty much resolved with antibiotics. Thank you. Okay, Mary, just some thoughts that you might want to consider with your symptoms of being off balance and having fatigue and head and ear pressure. Number one, being off balance sometimes can be a symptom of Babesia, actually. And Babesia can give you a great deal of fatigue, okay? So take a look at the article we have about how to diagnose Babesia. Read it, watch the video associated with it. You'll have to look at it in the Treat Lyme book. I've been showing you how to get there tonight many times, okay? But take a look at that article and see if you might have Babesia, okay? If you do, talk with your provider about helping you with that. And again, use our treatment plans for Babesia that you'll see in the Treat Lyme book too. Again, as many of you know, our stuff is really useful, okay? It's something you can do on your own, or even your doctors will be glad that you bring that information into them, all right? Other things to consider is if you're still, besides Babesia, because it may not be Babesia, I'm just saying consider Babesia, okay? But the other thing is if you're having head and ear pressure problems, and you have off balance, it could be an inner ear problem, all right? And for your inner ear problem, you ought to have, or to see if this is an inner ear problem, you ought to have an ear, nose, and throat doctor do an evaluation on you, an ear doctor do an evaluation on you, okay? So I would take a look at doing that too. All right, good luck to you, Mary. And thank you for that question. All right, so I'm gonna post a question from Debbie here. So let me go ahead and pull that one up. All right, let's see here. All right. Hello, Debbie. Let's see. I'm currently taking Doxy for 8 months and Levaquin 7 weeks for Lyme and Bartonella. I have peripheral neuropathy. I took tinidazole for 2 days on, 5 days off. On day 4 to 6, I had severe burning pain in the left foot. That was 3 weeks ago. My left foot is still more painful and numb than pre-tinidazole. I haven't retaken it. What do you think? What do you recommend for the cyst form of Lyme? Please help. Thanks. All right, let me go back here. So Debbie's got a question about neuropathy and tinidazole. Okay, so, and also, well, tinidazole in general. Okay, so tinidazole is similar, or is a brother or sister of another antibiotic we use in Lyme called Flagyl, also known as metronidazole, okay? The comments I'm going to make about tinidazole right now are the same ones I can make for metronidazole here. All right, so both tinidazole and metronidazole are useful at treating the cyst form of Lyme. They also can get at biofilms, although tinidazole is more effective, okay? So biofilms, everyone, are layers of slime that can cover Lyme germs and I said may block treatment, all right? And sometimes we have to do something about biofilms. I'm not gonna have enough time to get into biofilms tonight, but as you know, I have written a whole article about biofilms. So if you want to know more about biofilms and whether you need to do something about them or what you can do about them, take a look at the Treat Lyme book after the webinar tonight. Read the article on biofilms, okay? All right, it's called Biofilms, all right? Actually, I think it's called gated community, or biofilms, Lyme gated communities, I think is what the article is actually called, okay? But if you search for it using our search page, you'll find it, all right? Okay, so tinidazole, metronidazole, good for biofilms. Tinidazole a little bit better. They also are quite effective at treating the microscopic cyst form of Lyme, but they're hard to tolerate for a lot of people. They have side effects that just make you feel kind of toxic and icky, number one, okay? But the other problem with metronidazole and or tinidazole is that they can lead to neuropathy in some people. Yep, they can cause nerve injury, all right? We think the reason for that is that they quickly deplete full vitamin B6, okay? And if you get neuropathy, the way to treat it, the way to correct it, if you're on tinidazole, metronidazole, is first, stop them. Secondly, start taking vitamin B6, 50 milligrams to 100 milligrams 2 times a day. So either a 50 milligram or a 100 milligram pill 2 times a day, okay? That usually is going to do a good job of helping to take care of the neuropathy, all right? So that's what I would wind up doing for that, okay? Now, what else can you do for your cyst? Well, grapefruit seed extract, the herb, grapefruit seed extract, 250 milligrams, 2 pills, 3 times a day. I'm sorry, 250 milligram pill, 1 pill 2 times a day. That's a 250 milligram pill of grapefruit seed extract, 1 pill 2 times a day is a great anti-cyst agent, okay? Now I said grapefruit seed. I did not say I said grapefruit seed. I did not say grape seed extract. I said grapefruit seed extract, okay? Because grape seed extract also is a supplement, which is an antioxidant that is not going to do anything for your cyst. Make sure you're using my recommendation here that is grapefruit seed extract, okay? All right. And let me see here. I think that answers your question. All right. Debbie, thank you for that question. All right, everyone. So that is it for me tonight. And I know I'm leaving a number of questions here on the table. I'm just looking to see if there's anything quick that I can answer here. It doesn't look like I have anything quick here. All right, everyone. Thank you for being here tonight. Thank you for joining me. Next week, I am off on spring break with my daughter and my wife. The high schools are out here in Seattle next week at this time, so I won't be here. I will be here 2 Wednesdays from now, and I look forward to visiting with you then. For those of you that tried showing up last week, I do apologize. I was actually at an appointment outside the office, and I had to take the Interstate 5 to get back here, and there was a huge traffic accident, and I just could not make it here in time. So I apologize for that. Tomorrow morning, look in your email. As long as you signed up for when you signed up for the webinar, you would have been asked to approve being part of our email list. If you did, you will get an email from me tomorrow with information about the recording that we're making tonight, how to access that recording, okay? If you're not sure if you did say yes to being on our email list, search for MailChimp in your email. You will find an email from me from MailChimp that basically said, do you want to be part of our email list? And if you said yes to that, if you gave approval, you are now part of our email list, okay? And we will send you an email tomorrow telling you about that, telling you about the recording being available, okay? Here in a second, at the end of the webinar, you're going to be taken to our Treat Lyme book, to the homepage for that. From there, you can start searching through the articles. And if you happen to not be subscribed, if you try to reach an article for which you are not subscribed, you will wind up being asked to subscribe to the Treat Lyme book. I hope you will do so and that you'll support the efforts that we're doing here so that we can provide more articles to more people, all right? And if you do find what we're doing here beneficial, please tell your friends, please tell your family. They may benefit from these webinars. They may also benefit from the Treat Lyme book, okay? All right, everyone, I look forward to seeing you in a couple weeks. Have a good evening. Bye-bye.